Greetings, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Michelle Guadalupe, Advocacy Alliance Development Director for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on step therapy in Illinois. But what do these victories mean for patients and their access to care? The Arthritis Foundation has got you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that patients in your state know their new rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the step therapy law in Illinois that was fully implemented in 2018 and what to do if you feel the law has been violated. First, let's define step therapy. It is a protocol or program that establishes the specific sequence in which prescription drugs for a specific medical condition and medically appropriate for the patient are covered by a health plan insurer. We had amazing champions in the Illinois legislature on the step therapy bill, and we wanted to say a huge thank you to each of these legislators. So what are your rights? Now that there is a law in Illinois on step therapy, we want to make sure you know what that means. If an insurer denies a request within 72 hours or 24 hours for expedited, they must provide a reason. There are different medical exceptions that now shall be approved, and that is if the required drug is contraindicated, which means the drug may be harmful to the patient has tried and failed a drug under the current or previous insurance, or the patient is stable on a prescription drug selected by his or her healthcare provider. We also want to make sure that folks know who is covered under this new law. Patients with state-based plans, along with plans in the exchange, are covered. Typically, Medicare, Medicaid, or self-insured plans are excluded. The best bet is to contact your insurer and provide your policy number to learn if you are covered under this new protection. If you are getting a prescription that is denied, at this point, you may want to talk to your pharmacist and healthcare provider about alternatives that would be covered. You could also decide to pay out of pocket and compare discount cards, cash prices, and assistance programs to determine what works best for you. We also know at this point you might be wanting to begin the appeals process. So you want to make sure that you document. So if you go see a pharmacist, you'll want to ask them to write down what they had heard from your insurance company. You'll also want to call your doctor and report the problem and see if they can suggest next steps to get your medication. You can call your insurance company and find out how to appeal the decision. Many times your physician will often need to intervene and write a letter. Make sure you also share copies of any insurance letters information you receive with your doctor, and make sure that you all are on the same page. In working with your insurance company, it's always good to make sure you check with your Human Resources office to learn specific rules to your plan. Check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. So be sure to call your insurance company to find out why your medication did not receive approval. The number to call should be on your insurance card. Find out if your appeal needs to be online or if there's another process from your insurer. Again, like before, you'll always want to make sure that you keep notes of all your conversations, who you speak with, dates and times of calls, any case reference numbers. Making sure that you have good records can help move future calls forward. Stay in touch with your doctor through the process and share information. Your insurance company must provide the reason for your denial in writing, and ask about it if you have not received anything. Also, if submitting an appeal yourself, include all of it relevant documents that may help your case. This can be letters of support from your physician, test results, and your personal narrative. If you feel, though, at this point that your insurance company is not compliant, what do you do? With that, we really want you to get to know your insurance commissioner. And this here is a website and a phone number where you can call the Illinois Department of Insurance Customer Assistance, and they can help you through this process as well. But remember, before you can request an external review, you must have completed the interview review process provided by your insurance company and received a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit your coverage and care through the prescription for access. This go-to resource will help you better understand healthcare coverage options, determine how your current plan meets your arthritis care needs, and guide you through the claim denial process. The kit includes information, tips, and tools for consumers to get the most coverage and avoid or minimize claim denials. The kit includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeal process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, tailored solutions to inquiries about arthritis and its management. The phone calls are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medication, and community resources. Thank you for listening to today's webinar, as we want to make sure that new state laws are being implemented fully so patients can enjoy their new protections. Thank you.